Hello, and thank you for coming to my presentation. My name is Stephanie Morocco, and today I will be presenting preliminary results from a survey to collect physical activity preferences for persons with neurological conditions. As most of us know, physical activity is important. Participation in physical activity 2 to 3 times per week can reduce the risk of negative health outcomes. Persons with mobility challenges as a result of a neurological condition often have low participation in physical activity, which can increase their risk of secondary complications or other negative health outcomes. There may be many personal or environmental barriers that hinder participation, such as lack of appropriate physical activity programming and facilities, or that the facilities that are available do not have appropriate policies or design for different mobility challenges. Motivation also plays a large role in physical activity participation. Client-centered input in the design of programming are key tenets of patient-centered care and integrated knowledge translation, which are pivotal in this work. This brings us to the main objective of this work, which is to identify the preferences for physical activity programming for persons with mobility challenges as a result of a neurological condition. This cross-sectional survey is distributed nationally via REDCap. Currently, only an English version is available, but a French version will be made available in the near future. Underpinning behavioral theories for this work include social cognitive theory and self-determination theory. The diagram on this slide shows the key constructs of social cognitive theory, which include personal, behavioral, and environmental factors. The survey is broken up into 3 sections. Section 1 includes demographic and injury or diagnosis information. The second section asks about current level of participation, outcome expectancy, and other variables that might impact one's participation. And the third section asks about preferences for physical activity programming, of which includes timing, intensity, duration, frequency, types of physical activity, and other components that might increase engagement, as well as modes of delivery and any other information that the participant would like to share. We currently have 27 participants, about 3/4 of which are female, with a mean age of about 50 years, but the age range is fairly wide between 19 and 81 years old. The mean time post-diagnosis is 15 years, and this also includes a wide range of 1 year post-diagnosis to 50 years post-diagnosis. Most of our participants have spinal cord injuries, but other diagnoses include stroke, brain injury, multiple sclerosis, or other diagnoses. When asked about intensity, most participants indicated that they preferred moderate intensity activity. Midday, late morning, and late afternoon seem to be preferred times for participation in exercise. And in terms of format, most participants indicated that they are interested in having some instruction versus deciding what to do on their own, with a strong preference towards participation in live sessions. This included a slight preference towards in-person versus virtual exercise. The vast majority of participants did prefer having an instructor, and indicated that this individual should be somebody with appropriate training, working with people with various complex conditions. When asked about additional features or components that might increase engagement in physical activity, the ability to socialize either informally or in a structured way was indicated to be very important. Educational sessions and the ability to track one's progress were also of interest to participants. Interestingly, a reward system was not preferred by the participants. Self-reported barriers to physical activity were quite diverse as reported by the participants. Transportation, timing, and availability of suitable programming and facilities were among the most prevalent barriers. The immediate next steps of this work are to continue recruitment to increase the number of participants over the next year. The long-term goal of this work is to embed the findings into the development and implementation of physical activity programming locally and beyond. The poster for recruitment is on the right-hand side of the slide, and I would like to thank the RISC team for their support with this work. Thank you very much for listening to my presentation.